The first major outbreak of the novel coronavirus in the United States occurred at the Life Care Center of Kirkland, a nursing home in Washington state. 46 people associated with the center died of COVID-19. 1 year after those initial deaths, about a third of all COVID-19 deaths in the U.S., more than 136,000 of them, have been linked to long-term care facilities.
Because of longstanding failures to ensure sufficient staffing, to ensure the implementation of basic infection control protocols, that left elderly residents in U.S. nursing homes particularly vulnerable.
The American Healthcare Association, an organization that represents nursing homes in the U.S., claims the industry is now vulnerable because of added costs related to the pandemic like PPE, staffing, and testing. It predicts 2/3 of nursing homes will go out of business by the end of this year if Congress doesn't approve an additional $100 billion in relief funds, with a substantial portion going to long-term care facilities. Charlene Harrington has been studying the industry for 4 decades. She says nursing homes are less profitable than they were pre-pandemic, but she doesn't think the industry needs more taxpayer money.
They're making lots of money in these for-profit companies. And so they want to get sympathy right now when it was really, a lot of it was negligence and could have been prevented.
Last spring, nursing homes and other healthcare providers received tens of billions of dollars in aid as part of the CARES Act. Watchdog groups say there has been a lack of transparency in how the funds have been spent.
A lot of facilities now commonly use what's called related party transactions to hide profits. So they may sell the underlying nursing home property to a company that they themselves own and then charge themselves whatever rent that they want, and then turn around and say that they don't have enough money to provide care to residents.
Americans have traditionally relied on nursing homes to take care of their frailest seniors. But amid reports of negligence and dire conditions, many families are reevaluating their housing needs. The nursing home industry was already under pressure pre-pandemic. According to a report by the Kaiser Family Foundation, occupancy at U.S. nursing homes was at 80% in 2019. That's a 4% drop from a decade prior. Numerous surveys have shown that many Americans don't want to go to nursing homes. They'd rather hire home aides. Harrington says that should be the priority.
People are doing everything they can to stay home. And that's for the best, as we can see during the pandemic, because the nursing homes were really not good at protecting the patients.
Karina, CGTN, New York.